here.
All right, staying with that vaccines, let's talk to Dr. Were Onyino, who is the president of the Kenya Medical Association, on that. Thank you very much, sir, for joining us here on News Desk. Now, over 1 million doses arrived in the country. As the president of the Kenya Medical Association, what are your thoughts about this, considering we've been hearing from different quarters that there has been lack of involvement?
But thank you. I think the 1 million doses is actually a very good thing that we're having as a country in terms of fight against the COVID-19 pandemic. And I think it's going to go a long way in terms of helping us resume normalcy as quickly as we can. The issue of involvement of all stakeholders, especially the healthcare workers, I know that has been wanting. But you still have a window where we can properly disseminate information about the safety of this vaccine and about other issues to avoid any vaccine hesitancy amongst the first group of frontline healthcare workers who are supposed to be vaccinated first.
All right, you've talked about there's still a window in educating about the safety of vaccine. Are there any plans? When is it set to start?
As Kenya Medical Association, we have been educating our members, but I know working closely with the Ministry of Health, we can scale that up so that we ensure that each and every frontline healthcare worker actually is vaccinated and there is no case of vaccine hesitancy regarding the rollout of this vaccine. I know amongst the studies that you've done, around 28%, which is a very small number, of healthcare workers are concerned about the safety and the speed of development of this vaccine. But as Kenya Medical Association, our stand is vaccinating the population to achieve herd immunity and control this COVID-19 pandemic is the way to go at this current state.
All right, let's talk about this vaccine. Many questions are arising from different Kenyans saying, why exactly should I be vaccinated if I can get the virus after being vaccinated? Talk to us about that. The vaccination of the public is a public health initiative that has been proven to work over decades since we started rolling out vaccination of human beings way back in the 19th century. The issue of you getting infected with COVID, you get some form of immunity that is not long-lasting. And that's why the scientists have come up now with a vaccine, especially for the AstraZeneca Oxford vaccine, where you get 2 jabs, which will give you a long-term kind of protection compared to when you get vaccinated, where you get between 3 and 5 months kind of protection from the infection that you have gotten. So getting vaccinated is the way to go, and I'd like to encourage everyone, especially the frontline healthcare workers, to actually jump into this ship so that we can control this surge of infections that you're seeing. All right, this vaccine comes at a time when Kenya has seen an increase in the positivity rate when it comes to the COVID-19 numbers. Are there any implications to this?
None whatsoever. I think actually even if it had come 4 weeks ago when positivity rate was around 3 to 5%, we still have vaccinated. The issue here with the vaccination program is to have a critical mass of the population having protection against the infection, and in cases where they get infected, then they do not get very severe infection that will necessitate ICU care. So it's still timely in terms of the timing of the vaccination to help break the cycle of infection and help protect a bigger chunk of the population.
All right, there's still some concerns about opening up the entire process to the public, a process that is the public sector, to be opened up to the private sector. What exactly do Kenyans need to know when it comes to opening up the process to the private sector in terms of safety, in terms of quality vaccinations? Talk to us about that.
I think the private sector involvement is something that we should be very cautious about.
Okay. but still recognize the fact for us to quickly cover a critical mass of population, then we need to bring in the private players in terms of ensuring that everyone has access to the vaccines. So in as much as it's something that we need to approach with caution, then I think the Ministry of Health needs to be on top of this in terms of ensuring that we monitor the vaccines that are coming into the country, we monitor the adverse effects that will emanate from it, and we monitor the cold chain process in terms of their storage, so that we ensure, since this is a public health issue, that every person, whether you acquire it through the government system or through the private system, then you have access to the same quality vaccines. We all are aware about when you open up everything to everyone, the issue of counterfeits coming into the market. And I think the Pharmacy and Poisons Board need to play a very critical role in ensuring that we only have quality approved vaccines by the Ministry of Health circulating in the population.
All right, thank you very much, Dr. Were Onyino, who is the president of the Kenya Medical Association, just giving us some insight on that vaccine, those vaccines, around 1 million doses of AstraZeneca vaccines that arrived in the country yesterday night. Well, we take a short break here on News Desk. We still have much more on the other side. Keep it KT News.